Good morning. I'm Elaine Chapnick, welcoming you to the October session of the Larchmont Mamaroneck Local Summit. Before we begin today's program, however, as an organization that focuses on public issues, I think it's important. Elaine Chapnick, welcoming you to the October session of the Larchmont Mamaroneck Local Summit. I think it's important to say that we are shocked and brokenhearted over the atrocities committed by Hamas in Israel. We are a community that joins together in times like these. And in that spirit, I want to mention the tri-municipal vigil to show support for the state of Israel that will be held tomorrow afternoon, Wednesday, October 11th at 5:30 at Harbor Island. And now, in contrast to all this dire news, today's program is designed to inform and inspire you about the caring and sharing that our community provides to families with dependent children needing special services. So I'll turn the program over now to today's chair, Rena Beater. Rena.
Thank you, Elaine, and thank you for your words. Today's program is a wonderful example of the mission of the local summit. The local summit was formed to facilitate collaboration among government, schools, nonprofits, businesses, and residents to strengthen our community's human services programs by increasing their visibility and appreciation by the public. I want to introduce today's panel. Selena Gomez is a senior case manager at the Community Resource Center. Celine began at the CRC as an intern in 2020, went on to become a case manager, followed by her promotion to senior case manager. Her ultimate goal is to obtain a master's in social work. Lisi Garcia is a bilingual social worker and serves as the coordinator of school social workers for the Mamaroneck School District. Prior to joining the district, she was a social worker at a shelter for undocumented children and continues to volunteer there. Tina Sarangani is the president of the Larchmont Friends of the Family. Friends of the Family is a local not-for-profit volunteer organization that has been helping families in our community for over 20 years. The group offers support to those in the communities of Larchmont and Mamaroneck who've been faced with a medical crisis or loss. Tina is also an assistant professor at NYU and a geriatric nurse practitioner. I want to thank Tina for participating today as she is attending a conference in a time zone where it is now just a little after 5 a.m. Nancy Borzane is the case manager for Friends of the Family. She brings her compassion and experience as a nurse and the former nursing supervisor at Memorial Sloan Kettering to her volunteer position in Friends of the Family. She's also working as a substitute school nurse for the Mamaroneck School District. Before we begin to discuss today's topic, which is focused on addressing the ways the Mamaroneck School District, CRC, and Friends of the Family work together to meet the needs with families of dependent children, I want to take a moment to turn to Celine and Lisi to talk about their work to support families who once again experienced flooding during the recent rainstorms. Also, if you did not view the Summit September program on reducing personal flood risk, you can access it on our website and also on LMC's website under the series tab. Finally, one note on questions. During the program, you can submit questions in the chat. Once we get to that portion of the meeting, I will read your questions for our panelists. During the Q&A, you can also use the raise hand function. So with that, Celine and Lisi, I want to turn it to you and just talk briefly about the work that the two of you have been doing to support families who experience flooding.
Thank you so much, Rena. I am Selene Gonzalez. I want to express first of all, I want to express my gratitude for choosing me as a representative for CRC. I'm serving as the senior case manager, and for the last 10 days, we've been focusing our efforts on assisting the families who were impacted by the flood on September 29 and 30th. These families, we have about 13 families that were displaced, and CRC focused on getting shelters for them, focus on connecting them with the school district to get transportation from the shelter to the schools, Families were placed in hotels recently. They were first placed in hotels in New Rochelle, then transferred to the White Plains and Mamaroneck areas. CRC also has been assisting these families with the support of the community with gift cards and basically helping them get back on their feet with connecting them with other organizations and with the community. The community has been also very supportive. These families have been getting assistance with food, hot meals since the day of this tragedy happened again in Mamaroneck.
Thank you.
Thank you.
Lisi, I know that the two of you speak very frequently, and
Yes.
just talk a little bit about what's been
Yeah,
going on.
absolutely. You know, I think this time around, because we learned from Ida, our response and our teamwork ability was much quicker, right on point, right? Identifying families and speaking, sharing information with Selene, with Janet, with Randy, kind of like if I didn't know something, they may have up-to-date information that we can then provide to certain families or our administration here at the school. You know, since COVID, our relationship really has fortified, and we are able to really proactively react in a positive manner to provide the needs and care and support for our families and our students, and we do that together. So it is really a great process, and we are very fortunate to have Selene and the CRC team as part of our team, our school team as well, because they really are. Without them, we wouldn't have been able to get some information and vice versa.
Thank you. And thank you for the appropriate pronunciation of Selene's name. So thank you. Thank you for that. And Selene, I apologize. With that, I want to turn to our panelists. Tina, I think it would be wonderful for you to begin to talk a little bit about the work of Friends of the Family, your mission, and also if you would speak a little bit, and I'd like you all to speak a little bit about this, how you came to work together.
Yes, thank you so much. And thank you, Rita, for bringing attention to the work that we've been doing. Larchmont Friends of the Family has been a nonprofit organization in this community for we're getting over 25 years at this point. It was formed originally by Mary Stein and Kathy Stout in their living rooms, along with many other community members, to address the needs of families with dependent children when either a parent or child becomes seriously ill or passes away unexpectedly. And so having had illnesses in their own family, they immediately recognize that neighbors, especially where we live, always want to do the right thing. They want to come by, they want to bring you a casserole, they want to see how they can support you. But sometimes that assistance, there's so much more that's needed often. And so Friends of the Family effectively served for a while as a community fund, really where you could provide the assistance of good neighbors and then some. And so we provide families, not only with meal trains and emotional support as good neighbors do, but we also provide families with those with dependent children with financial support to really offset the costs that are often brought on by illness or unexpected death. So imagine you become seriously ill, you get a cancer diagnosis, you're the primary earner in your family, and you can't go to work. As Selene and Lisi pointed out, the families in our community across Larchmont and Mamaroneck have a range of needs, and we are so proud that we can service them in a customized way for every family that's affected. So, for example, in many parts of our community, if a single family member who's a primary earner can't work, they often don't have paid leave or supports that enable them. And so that means that they're at risk of losing their housing, their family could become food insecure. And that's where we step in. For many of our other families, it's really that emotional support to say, okay, for everybody. What is keeping you awake at night? What is keeping you from getting better? We want you to focus on healing or grieving or moving forward. And we want to take what we can off our plate. So it's a wonderful organization which does not exist everywhere, which I always say speaks to just how special the community that we live in is. We've been reached out to over the years for a number of years by places as far away as Hawaii, communities as far away as Hawaii, to say, we've heard about your organization. Can you send us your bylaws? Can you tell us how you do it? And I will say that many of them have not been as successful, which I think just speaks to the generosity of our community. Nancy, did you want to add anything?
No, I think that pretty much sums it up. You know, when I first moved to Larchmont in 1999, I met our local lawyer who drove us back out to Larchmont to see our new home and was talking about all the things his wife was involved in. And I said to myself, oh, I hope someday somebody will want me to be part of something. And a few years later, someone did. Someone from Larchmont Friends of the Family said, would you like to be involved in assessing some of our families for their needs? And that's how it began. The wide range of needs, the wide variety of people, the friends I've made, because everybody I meet through Larchmont Friends of the Family, every single client is my friend forever. And it's enriched my life in ways I can't even describe to people. Such the relationship we have with the people, what we're able to provide for people, the art of assessing what people need at this time, working with the people in the schools, and now the CRC has just made this the most fulfilling enterprise that I'm currently involved in. So I'm free to talk, answer any questions that might come up or fill in some of the blanks.
Thank you, Nancy. Celine, do you want to speak a little bit about your work at the CRC and how you work with both Friends of the Family? And then I'm going to turn it over to Lisi and ask her about her involvement with the school. So if you would speak a little bit about that too, that would be wonderful.
Thank you. Yes, we definitely appreciate the partnerships that we have with Friends of the Family and with the school district as well. So we believe in holistic approach. So as we assess a family, we try to get as much information as we can, and when we encounter a family that is in a medical crisis, if they belong to the community, Larchmont and Mamaroneck, we connect them with Larchmont Friends of the Family. It could be a chronic illness or anything. We connect them with Larchmont Friends of the Family, and we provide translation services with Larchmont Friends of the Family if needed. We provide transportation services. We also provide advocacy for these families. So we connect them with Friends of the Family, and that's when the magic starts to happen with them, because they, like Nancy and Tina mentioned, they help the family in many different ways that they could help them navigate these hard processes.
Thank you. And Lisi, I would imagine that the school is the point of first contact for children coming into school. Teachers always, like to say that if you don't want me to find out something about your family, don't say it in front of your child. So could you speak a little bit about that as the point pretty much of first contact?
Yeah. Like you said, the kids are the ones who kind of come and tell or share or are having a bad day. And then we're able to assess what the family's needs are by calling the parent. And then it's really when we find out that, a parent is sick or a child is sick, or there is some type of medical intervention which is now impeding the family's day-to-day, whether that's financial, whether it's just coming to school, whether it's simple things that we every day take for granted. When families are in stress and are in need of help and support and kind of love, we reach out to CRC, we reach out to Tina and go, we have a family, we have identified a family who is currently hospitalized or will be hospitalized or, a very terrible diagnosis has happened and the family will be impacted forever. And that's how we build community, and through our different points of intervention, really build resiliency with our families and our community. And it's so impactful for us who are working with the families and working with Tina and Selene, but it's most impactful for the families and, their whole family. Sometimes you think about just the nuclear family, but it's really impactful to the entire family, the aunts, the uncles, everyone. It is a very positive and inspiring collaborative work we are able to do together.
Thank you. There are so many wonderful organizations within this community and so many people, as you said, Tina and Nancy, who roll up their sleeves and are willing to dive in and answer the call pretty much whenever it's needed. So how did the school, I pretty much know is at the hub of all of this, but how did all of you come to work together? Because there's so much to be done that the natural thing to do is to just put your head down and say, okay, I'm going to take care of this. And this notion of collaboration, that's actually going to take more time and time away from what I need to get done. So can you talk a little bit? One of you mentioned COVID. I can't remember which one of you. So may have been Tina or Lisi or Selene. So could you just speak a little bit about how you came to know about each other, your work, and what you could do to really strengthen and reach more families in the community?
Would you mind
Tina,
reading?
are you starting to talk?
Yeah, thank you. You know what? I will say that when I took over in this role almost like 6 years ago, it was before COVID had happened. And we knew that our biggest fear at Larchmont Friends of the Family is that we're going to miss a family, that we're not going to get a referral, that there's going to be a family in desperate need in this community, and we're not going to know about them. All the work that we do is private and confidential. So sometimes families haven't even heard of us. So prior to the pandemic, I had tried to reach out, and I want to give one shout out to Dina Reynoso, who's the social worker at Mamaroneck Avenue School, who is just really a dearest friend to Larchmont Friends of the Family and always reaching out to us. But I had asked Dina, can we get in a meeting with the school social workers? Can we tell the folks at MAS what we do? Because a lot of them hadn't heard about us. And prior to the pandemic, it was so hard. Everybody was all over the place. Everybody had a million meetings. It was very hard to get us in the same room, and we couldn't do it. And then COVID struck. And Noreen Mazzoni, who was then the assistant superintendent of special services, convened a group and said, we really have to be thinking about what we're going to be doing. Should a parent pass away unexpectedly? Should a child pass away from COVID? These were the very early days. This crisis had hit the world. It had certainly hit our community. And it was an all hands on deck approach. And she pooled all the local agencies in addition to her incredible staff across the school. So we had all the school nurses, the social workers, the building administrators, as well as teachers, as well as community organizations, including the Larchmont Mamaroneck Community Counseling Center, the CRC, and others. And we all, for the first time, sat next to each other at a table and said, what are we going to do if a family is afflicted with this crisis? And the beauty of that, which is this relationship and this work and collaboration that we do now exists well beyond COVID. And what it does, and I want to point out that Larchmont Friends of the Family was designed to help families who are facing an acute period of crisis due specifically to a medical illness or a loss. And our desire is to help bring these families stability. And when we partner with CRC and when we partner with the schools, we can ensure that this support and stability extends well beyond the 3 months that we work with these families, because the CRC and the schools make sure that these families are on stable footing going forward.
Thank you. And yes, I also want to note that as part of that group, we did have the bereavement center, and Anne-Marie Conlon also had joined us, and they were a wonderful resource during that time. And I do remember her pointing out that, a loss is a loss. It doesn't matter what the cause was, whether it be COVID, illness, a tragic accident. a loss to that particular family is felt very deeply. Selene, so what type of supports do you offer families? I know that Tina just mentioned, I'm looking at Lisi, that Tina mentioned that their support really only goes for 3 months. And, with so many families sadly experiencing a medical crisis or loss, there is a limit to the resources. So can you speak a little bit about how CRC steps in?
Yes, thank you. To address these needs, we participate in various coalitions. It's within the region and outside the region throughout Westchester. We support various needs during the moments of crisis, and they come in with shelter, food, mental health, illness. We rely a lot on our community partnerships. And we do mental health support and also non-crisis moments. We meet with other forums and youth development programs. So we could say that we rely a lot on partnerships, and we can help connect the families with other organizations through our referrals, through a referral system. We have a big referral system, and that helps us address those needs beyond whatever it's needed at the moment or during the moment of crisis.
Thank you. And Lisi, what type of work goes on with the children in the school? Do you then refer them to the community counseling center or to other therapeutic supports? How does that work?
Correct. So we get a family or student who we know is either having some type of medical illness or the flood or something, something that really limits their ability to have a normal day-to-day structure and day. We then assess what is the need, and depending on what that is, we would refer to CRC, refer to Tina and her organization, also refer to for counseling. If it's clothing based, we make a referral for clothing. The organizations available out there who can provide the need for our students, as well as working within our school with the PTAs and our admin to find out what is available for the student and how we can best address that need. And understanding that for something impactful, an incident, a life moment, that the support will be needed a long time. It's not a short period type of service that we just give and stop. For a lot of this, our families, we will follow for many, 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 many years. A great point was, Ida came 2 years ago, and everybody went back. Some homes were built. But a lot of the families who are suffering, this is their second time. So really talk about the trauma of losing, of not having, and then to do it again. It's a lot. So we're able to then assess and deal with the children here, provide that clinical intervention, and then resource out for services that we can attain. So we would go to CRC or Tina.
Well, and speaking to the relationship that we all develop with our families, we are most often contacted when the crisis is acute. It's a new diagnosis, it's a death. Intervening at that time, for the period of 3 months, we assign 2 very skilled assessors to work very closely with the family. For the period of 3 months, we exchange cell phone numbers and emails. We visit in person, we meet up, we go to their homes. For that period, it's a bridge to what their new normal is going to be. And I'm in touch with so many families that we helped. I either see them, I see their children in the school. After this is over, I'm going to the brand new barbershop of a young boy that we helped through his testicular cancer treatment, changed his career goals, and now opened a barbershop. And my fellow assessor and I are going to the opening today. We've gotten referrals from former clients when they hear of something new. Teachers in the schools contact us. So problems continue, people's roads change, but that bridge from the acute to what's the new normal is where we intervene. And we feel like we make a tremendous impact that way, only made richer by working with the CRC and people in schools. And I do have to highlight that Dina Reynoso, she's the best.
Thank you for that, Nancy. And okay, I'm not muted. And I really like that notion of a bridge to the new normal. And Lisi, how you talked about that this is not just dealing with an acute crisis, that you support the students, because trauma is an echo that lasts, and how you support those students throughout that time and families, and it could possibly be years. So thank you for that. Nancy, I'm going to start with you. Could you just talk a little bit? I love the story about the barbershop. Could you just talk a little bit about the process and when you get a phone call, what happens?
So we get our information in a variety of ways. Certainly word of mouth, we keep our ears open. I even got a referral from my sister-in-law in Old Saybrook, Connecticut, whose cousin grew up in Pelham next to somebody that lives in Larchmont. Opened up a case because their daughter was undergoing cancer treatment. So a family has to agree to be visited by agree to be part of our process. I either call them directly. If I get a referral, the referring friend who calls us will say, yes, they've agreed that they would love to get a call from you, the social worker, whoever in the schools. So I'll speak with them. I'll explain our process, that you'll meet with 2 of our assessment team. We'll be with you for a period of 3 months. We work on what plan month by month is going to best help you. We'll draft an assistance letter that you'll sign. We'll agree to pay any vendor directly, and help comes in a variety of ways. And that's the skill of the assessment. Whether you need help with estate planning, whether you're unable to work and your mortgage needs to be paid, do you have any hospital bills? Is getting to appointments hard for you? What's your family doing for meals on treatment days? And we have a meal train totally made up of volunteers. As a matter of fact, there was one local gentleman who very calmly said he needed very little assistance. His insurance was good, but those meals, he loved opening up his door and having a meal. He thought that was the best thing that ever happened to him. And then just the visits with the assessor. So we meet with people, we start the case, assess monthly, communicate during the month. We end the 3 months, summarizing our assistance. Always keep in touch with people who always get back to the assessor to tell them how it's going, what's happening next, how their children are doing. It's a relationship that spans forever. For many years now, we've had a local family. Instead of exchanging gifts among each other at the holiday time, we assign them children and families from the previous year with their wish lists, and they donate Christmas presents that we go around and distribute to summarize our year. So our process, while it is limited to 3 months, extends way beyond that. And very few families decline the help. I'll call people and who will say, look, I think we're okay for now. We don't really need anything. And I'll always say, that's fine. We're here. If you don't mind, I'm going to just keep your number and I'm going to call you in a couple of months and see where you are. And those at times like that often do turn into cases. We've had people self-refer who didn't quite meet the criteria, although they were struggling. Then an illness or a surgery would come up. And I'll always revisit them and say, look, I'm so glad we met a few years ago, because now, look what we can do together. So it comes in a variety of ways, always confidential, always with the assurance that we're going to tailor this to your needs and nobody will ever know.
Thank you.
That we're just friends.
Thank you, Nancy. Tina, all of this takes resources. Can you speak a little bit about how you obtain resources, how you get that army of volunteers involved? And Selene, I'm going to ask you the same question, because I know that you've probably all have certain people on speed dial, but you need to reach a pretty broad group of people to provide this level of support. So could you speak about that a little bit, Tina?
Sure. And I think that we should bring up a little bit about what the recent history of Larchmont Friends of the Family. So we shared about that with this organization was created 25 years ago. But I came to know Larchmont Friends of the Family when my family and I moved here just about 8 years ago. I was actually in a Larchmont newcomer play group, and one of the women in the play group with me, her mother happens to still be on our board, Gerald Hoffman. And at that point, Gerald had said to her daughter, you should really try to find some friends who might be interested in volunteering, because we're pretty much on the verge of shutting down. A lot of the senior leadership of Larchmont Friends of the Family, their children were grown. They had moved out of the community. The referrals were no longer coming, not because there was no need, there's certainly a need, but because they were not as connected to the schools as they once were. And so when I first heard about this, as you can imagine, with my professional background and my personal training, this became a passion project. And I said, I'd be really interested in doing this. And I started, Nancy took me on my first case, actually, and it changed my life. It changed how I view this community. It changed how I viewed the incredible generosity of the people here, and really what the power and potential of this organization can do for families in need, in terms of really not just being good neighbors and exercising compassion, but really addressing social determinants of health, and picking up where our policies, frankly, around healthcare fall short. We discharge people from the hospital with no plan about how they're going to function. And so over the years, it has taken a lot of time to rebuild and reintroduce this organization to the new generation of families that live here. It has required an incredible for a group of volunteers that's consistently growing. And we have really been able to connect as a result of that with the different elementary schools, at the middle school, at the high school level. Through COVID, of course, we were able to build up our connections and community engagement. And then, of course, all of this requires fundraising. And so in 2017, we had our first fundraising event, and we just said, the purpose of this event was at the time to just reintroduce this to the community. And since then, that is what we have been doing on an annual basis. Of course, could not have our fundraising events during COVID. So for a few years, did not have our annual gala, which is pretty much the entire source of our annual operating budget. We never, as an organization, ask for money if we don't need it. I will say, though, since in the last few years, the demand has been unparalleled. Since I took over, our dollar amount of assistance that we provide to this community has tripled. And so it has required a village. It has required the villages of Larchmont and Mamaroneck and the town and everybody to come together. And there's many people who were part of the original history of the organization who were so happy and a little bit surprised, quite honest, to see that we're thriving. And we've been successful in introducing this. We've been able to connect with houses of worship across the community to let them know that we're here. I'm so thrilled to be part of the Larchmont Mamaroneck Summit, to share with other community leaders about what we're doing. But it has really required a lot of, as Nancy said, word of mouth assistance, support from various organizations, and bringing awareness while still preserving the anonymity and confidentiality of what we do.
Thank you. Selene, do you want to speak a little bit about, who's on your speed dial and how you reach people and also raise funds for doing this important work?
Yes, thank you. So as Larchmont Friends of the Family, CRC has been in the community for now 25 years, and CRC has been empowering immigrant and low-income families in Mamaroneck and the southern Westchester region. And we rely a lot on donors, local donors, grants. We apply. We have our gala coming up in November 16. Whoever wants to join is more than welcome. We do fundraisings, and we reach out to the community pretty much by word of mouth. Or immigrant families in the area rely a lot on the CRC and the collaboration that CRC has with other partnerships, and that comes with the programs that we have. The ESL programs, the nanny trainings, we have a lot of training. So most of the CRC work is word of mouth, and we also advertise on our network, in our social networks like Facebook, Instagram. So we do rely a lot and also on our volunteers that provide our programs, and also on the families that support us in the community.
Thank you. I want to go back to focusing a little bit more on the children and also on the stories of families that you have heard and how it worked from referral through the end of the process. And Lisi, I'm going to start with you. One of the things that I'm curious about is a social worker may hear about a student whose family is struggling with an illness, or a family who's had a loss. And many times there are students in multiple buildings. How does that coordination take place, and what's your role in that?
Sure. So I'm thinking of like a recent family that we were all involved with, who was a long-term Mamaroneck family. So the person was raised here after coming from their home country, has made roots, had made a family. So that one person, that one student that we found out from was not even the person's child. It was a niece. So little by little, which was one that child was in the high school. We had a couple at MAS, we had one at pre-K, to show you really the gamut of where this one family was at the moment of finding out the illness. We found out, I spoke to Dina, I'm like, hey, do you know about this? I know you have this little girl here. So we started doing some information, started talking, and then we found out that, this parent was diagnosed with stage 4 cancer. At that moment, we contacted Selene because they were already working with the family on and off, throughout their time here. Then we contacted friends of the family because we knew that the intervention would be 100% needed. We just didn't know length of time. At that point, I know Nancy went to do a home visit with Dina. And it was, as heartbreaking as it was also beautiful to have everyone together. Selene, I believe, was there. Someone from CRC was also there doing the whole visit, and just as a team showing up and saying, we got you, we can help you, we'll take care of the kids' response, we'll take care of the food, we'll take care of this, because we knew that this was not the best predicament. We knew. So, and that was September, and all the way to the end, the day of the funeral, all of us together, really making an impact for everyone.
Thank you.
And of note in that case too, and the day we all visited her in her home was one of the most touching days of my life. When I first was going to meet with the client, I had understood that her English was limited, so I enlisted the help of a former client of ours, a woman who works in the community, and we helped her family twice when her husband needed help and when her child needed help. And I deputized her and brought her to the initial assessment with me. She in turn went and galvanized some more assistance with the PTAs for meals and a big fundraiser. So love begets love. We had another former client who referred me to somebody else in the schools. people at the end of most of our cases say, I really want to be part of your organization and I really want to help. And they're good for it. I think anybody in their position, oh, I feel so bad taking things that could go to somebody else. Rest assured, we have enough for everybody, but I will call you if I need you, and I have. And you can imagine that happening to you too, your ability to give back. And everybody is just so happy to do it and so proud to have been enlisted in this cause. We were there when they needed it, and now they want to do it too. So aside from all the discrete ways we help people, there's a bigger sense of community that's built with all these efforts. That one case where we worked with the CRC in the schools when the father of 3 children suddenly died has just changed me forever. That was a partnership that could be published, about using our resources to work together to make a difference.
Could you all speak a little bit about that? I know we want to protect the privacy of the family, so you can meld together a few stories, but that was incredibly touching, Nancy. So if you could all speak about that a little bit more, in who did which piece and how much you work together to support a family or a combination of families. Nancy, you want to start us off on that?
Well, I think Tina called one day and mentioned that something tragic had really happened, and that she was convening a group with Nora Mazzone to try to really address the needs of this family. And really, as soon as she started to describe the family from working in the schools, I knew exactly who it was. And I knew this mother. I had spoken to her in my capacity as working in the schools. And she had a lot of things that very discreetly we could help her with. So while Larchmont Friends of the Family paid for the funeral costs, I worked with the CRC to get a little structure for her to keep her motorized scooter in downstairs. People from the CRC ordered it and had workers come to build it. Everybody did something to bridge this gap to the new normal, because it never was going to be really normal. But I was in touch with this mother for several months after that, who just bravely wanted to carry on and just felt very cared about. And that's when we really galvanized this idea that rather than using our resources for something somebody else could do, let's see who can do what, and open those lines of communication. And we've gone from there.
I want to add, Rena, if I may, that in that case, sometimes it is the simplest things that we do that can make the biggest difference to a family's life. And in this case, what Nancy was talking about with the scooter. So the mother herself had a disability and required a motorized scooter to get around. And her husband, before he passed away unexpectedly, was taking the scooter up and down the stairs for her. He would carry the scooter from the lobby, bring it upstairs so that it wasn't sitting in the middle of the lobby. There was really no place to store it, and it needed to be protected from the elements because it couldn't get wet. But when her husband passed away, this woman literally was losing her ability to go outside and be independently mobile because nobody could carry the scooter for her up and down the stairs. She needed a place on the first floor to keep it. And so we worked with the landlord and we identified this as a major thing that was keeping her awake, and used the funds to create a shed for her to keep the scooter outside. So in addition to many other things we did for that family, it is sometimes the simplest things that make the biggest difference for a family. And I will also point out that we have received a note, one of the families I worked with sent a note after our time with her was finished, saying that when my husband passed away, there was this dark fog around me, and you guys were the light that just helped me see through the fog until it eventually lifted and she could find her own way. And that's what we do. It's almost like we come in and we grab their hand and we guide them through those next steps of how to get to that through that day to day, figure out what they need, help them figure out what they need, and work around that.
And Tina, I just want you to clarify for everyone the groups that you do help, because clearly there is such a big need. You can't be there for every individual and every family. So what is your area of service and your mission?
Yeah, so I want to make that very clear to the community. We do wish we could help every single person, but our mission is really restricted, number one, to families with dependent children. And as you can imagine, I'm a clinician who specializes in older adults, so it breaks my heart that we can't, we often do get calls about other populations and we do refer them to the appropriate social service agencies, but we are strictly restricted to families with dependent children who really are within the confines of the Mamaroneck School District. And in order to qualify for our services, you must have a serious medical illness. So if families are contending with mental health issues, we work with our partners at the Community Counseling Center and others to support them. But really, our mission is restricted to those families with dependent children who have a medical illness or an unexpected death.
Thanks. Selene, I saw that you had unmuted for a moment. Was there something that you wanted to jump in and speak about a family and some of your work?
Yeah, it was about the case that they were mentioning, and I want to point out also that to build the shed, some of our daily laborers came in and worked on that. So that helped not only the family that was affected through this unexpected death, but it also helped another worker. So that's pretty good to point out.
I mean, the first case that I did with Tina, it involved getting mattresses. I mean, this family, it's really indescribable. The sick mother was sleeping on the floor. The 4 children were in 2 bunk beds. The other bedroom was rented to another family. So we assessed that this woman needed a place to live. So we bought the mattresses from Schiaparelli's mattress hockey sale. Everybody won.
Well, I don't see any questions in the chat. I'm wondering if there's anybody who is listening right now. This is also being recorded, so I know people will also watch it, and we'll send out a notice when we send out the recording to individuals on how they can reach your organizations, for Friends of the Family, and also for the Community Resource Center. So is there anyone who has a question? I don't see any hands raised currently. Up. Oh, Marlene, we can always count on you. Marlene.
I don't really want to ask a question. I want to say thank you. Can you hear me?
Yes,
Yes.
we can hear you.
I just want to say thank you to all of those groups. I mean, I remember when Friends of the Family was sort of dying when Jan Feynman left us. So I think it's really great that it's been reconstituted. And I just wanted to note that I don't think there's a congregation in this wider community that doesn't do incredible work for people who are in need in this community. So I certainly know the Social Action Committee at Larchmont Temple does it. And I know that all the churches have groups that are working to help, whether it's Midnight Run. It's not just in this community, it's everywhere. So I think we're an incredibly caring community and we're very fortunate to live here.
Thank you very much, Marlene. Okay, with that, do we have any closing words? Anything you really want people to know?
I just want to add, Rena, that, we were tasked during COVID to stop working as a district and start working as a community. And I think to that point, we do often work as a community, but it has really been, the pandemic was a catalyst for us to keep doing that and all use our resources more effectively. I think working together makes it certain that our resources go further, that every family is receiving the maximal support for the longest time that they can from all different sectors of the community. And we really are grateful for the support and recognition. And I will say that in that play group that I was part of 7 years ago, almost everybody is still very much part of Friends of the Family. So we're very grateful for that.
Well, thank you. And thank you all for participating. John Gitlitz, I see that you have your hand up. John, you want to unmute yourself?
Yes, I did put my hand up. When I moved to middle school, which was a very long time ago, my mother was finally able to escape from the house. And she became the founder in Binghamton, New York, a something called the Family and Children Service Society. And they did one additional thing to what you talked about. Their mission was to keep families together. And they would send generally late middle-aged women, often widows, whose children had grown up, and they would move in with a family where the mother was incapacitated or in the hospital or away, and spend up to a couple of months living with the family and taking care of the daily needs that went on. It's very labor intensive, but over the years that she ran it, they probably reached a couple of hundred families.
Wow.
And we would occasionally encounter either members of the families or one of the women walking down the street, and they would be effusive about the experience. Is there anybody or any group that does that kind of service in Mamaroneck? I'm done.
Thanks, John. I certainly don't have an answer to that question. It's something we could research, but I'm not aware of any organization. I see Elaine shaking her head as well.
It's an obvious need, and yet it's a need that is probably beyond the capacities of almost everybody.
Thank you. We have two more hands raised and it's 8:52 and we stick to our strict 9 o'clock. So I want to be sure to jump to those two questions. Ann Chotish has her hand up. Ann?
Hi. So I know about CRC. I've never heard about the other organization. And I'm just wondering, as just a member of the community who's hello, are you there?
Yep, you had muted yourself. Go ahead.
Being a member of this community my entire life, I didn't know about the Friends group, but between the two organizations, what would you like from those of us who are not currently involved?
Well, I think for Friends, thank you for asking that question. It's again a reflection of our community and the constant desire to give and support. I think from our perspective, we are always seeking volunteers, whether it is for our meal train to participate in that, whether you perhaps have some kind of skill, maybe you're a lawyer, maybe you know about estates law. Again, we just sometimes need people on our advisory board to help serve in that capacity when the need arises for families. But we, our volunteers who do the assessments, they're often nurses, social workers, psychologists, like Nancy and myself, or they're just people who've had serious illness in their own family and they know what it's like. Perhaps you speak Spanish and you want to help us with translation. That's another really useful skill. So that we're always looking for volunteers. And of course, we're always looking for support and recognition. Annually, we have our event in March and we do a one-time ask annually for support. So spreading the word about what we do and supporting us, whether it's through volunteerism or finances, you can also visit our website. It's larchmontfriendsofthefamily.org to learn a little bit more about it. And please always feel free to reach out to either myself or Nancy.
Thank you.
And a final question that we're going to take is Ann McAndrews. Ann?
Hi, I'm now unmuted.
Yes.
Okay, good morning. Well, I'm absolutely delighted to hear about Friends of the Family. I'm, along with Marlene and many others, were active in it when it was sort of a lasagna food brigade, and really appreciate what you've developed the Friends of the Family into, especially the meal train that you can do online. I'm also president of the Women's Club, and I believe that Friends of the Family is one of our one of the organizations that we contribute to annually. But I would like to get the opportunity to speak to Nancy and Tina, and maybe have you speak before our group. It's 160 women who are a certain demographic, but we could maybe focus our energies a little more towards service and towards Friends of the Family. I can promise you that many of the members have been participants in the past. So I'll try to reach you, and maybe we can come together, and maybe you could speak before the group. Thank you.
Thank you, Anne, and we appreciate the support annually from the Women's Club and from Larchmont Temple and the other Social Action Committee and all the other groups that do support us. Thank you so much for that. I did have the pleasure of addressing the women's group about 5 years ago, and they were incredibly receptive. And so again, thank you for the recognition and bringing us in to share a little bit more about what we do. We're always eager to spread the message.
Right, we'll talk. Thank you.
You know, and it's always about connections, because through my work in Friends of the Family, I became a Larchmont Lion. And the Lions Club supports Friends of the Family. The Lions Club supports the Eyeglass Mission that I go on every year. So, you know, and I do believe it's all about connection. So between Tina and I, we would just love to talk more to members of the Women's Club. I know a number of people in that group.
Right.
That'd be
Thank
great.
you.
Well, I want to thank all of you for participating, and more importantly, for the work that you do and the impact that you have on families in our community. Truly, truly thank you. With that, I'm going to turn it back to Elaine to close us out.
I want to also echo those words. Thank you, Rena, and thank you all of our wonderful panelists this morning. I want to also invite everybody to come to our next meeting in November 14th, where we're going to talk about food insecurity in the community. I also want to say I'm really sorry that this is not in person as we had once promised, but we really did feel that with the recent spike in COVID cases, it was prudent to retain the Zoom format for now. We're really eager to resume our in-person meetings, and we will let you know as soon as we feel it's appropriate and safe to do so. So thank you all for attending via Zoom. Thank you again for all our speakers, and thank you to this community. Once again, we see what a caring community this is, and how we do come together for each other and for even larger issues. So thank you again, and see you next month.